Hello friends, today I will explain about the topic patient-centered in clinical research. In this involving patients in research process to ensure that the studies address their needs, preference and values. This approach aims to make clinical research more relevant, effective and applicable to real-world scenarios. Here's we detailed explanation by uh, topic wise. First one is key principle of patient centered clinical research. In this, first is involvement of patients. Patients are actively engaged in the design, implementation, and evaluation of research studies. These can include input on the study protocol, recruitment strategies, and outcomes measures. Second is relevance to patients. Research focuses on the issue that are important to patient, including quality of life, functions, outcomes, and treatment experiences, rather than just clinical or biological endpoints. Third is collaboration. In this, research work in partnership with patient advocacy groups, and caregivers. This collaboration approach helps to ensure that the research is aligned with patient needs and preference. Fourth is transparency and communication. There is a commitment to clear, open communication with patient about the research process, include goals, potential risks and benefits. This transparency helps build trust and encourages patient participation. Fifth is assemblability and inclusivity. Efforts are made to ensure that research is accessible to diverse patient populations. This include addressing barriers to participation and ensuring that the study protocol are inclusive. Sixth is patient feedback. Regular feedback from patient is used to adapt and improve research protocol and particles. This feedback loop helps to make the research more responsive to patient needs. Benefits of patient central clinical research. In this, first is enhanced relevance. By focusing on what matters to patients, research outcomes are more likely to be relevant to real world clinical practices and patient experience. Second is improved recruitment and retention. In this, engaging patients in the research process can lead to better recruitment and retention rates, as patients are more likely to participate in studies that reflect their interests and needs. Third is better health outcomes. In this, research that designed with patient input can lead to interventions and treatments that one occur effective and better suited to patient needs, potentially improving overall health outcomes. Fourth is increased trust and collaboration. Building strong relationship between researchers and patient fosters trust and collaboration, which can enhance overall quality and impact of the research. For example, patient centered research approaches. First is patient advisory boards, involving patient in advisory board to provide input on research design and implementation. Second is patient reported outcomes, incorporating measures of patient reported outcomes to assess the impact of intervention on quality of life and daily functioning. Third is community based participatory research, collaborating with community members to identify research priorities and design studies that address local health issues. Fourth is flexible study designs, adapting studies designed to accommodate patient preference and reduce the burden of participation, such as offering virtual visits or simplifying consent process. Challenges and consideration. First is diverse patient preservatives. Balancing diverse patient needs and preservatives can be challenging, especially in large or heterogeneous patient populations. Second is resource intensive. Implementing patient centered approaches may require additional resources and time, including efforts to engage patient and address their feedback. Third is ethical consideration. In this, ensuring that patient involvement does not lead to undue influence or bias in the research process is crucial. Fourth is training and education. Researchers may need additional training to effectively engage with patients and integrate their feedback into research participants. Patient centered clinical research represents a shift towards more inclusive, relevant, and patient focused research practices aiming to improve both the process and outcome of clinical investigations. Thank you.